All right, welcome everybody, and thank you so much for joining us today. Um, you know, uh, the this is, I think, a particularly interesting segment we've got. We have taken the time tonight of Professor Jonathan Metzl from Vanderbilt University. He is the Frederick B. Rentschler II Professor of Sociology and Psychiatry at Vanderbilt. He's the director of the Center for Medicine and Health and Society at Vanderbilt University. But most of all, he is the author of, he's very well written, and he's the author of a multitude of books. The one that has gotten a lot of press lately and is a very provocative discussion of politics and its healthcare effects is this book right here, Dying of Whiteness. And I'll let him talk about it. What I remember is when this book first came out and Dr. Metzl was presenting it to the public, maybe for the first time, a large number of radical right, I think even armed people showed up at the book presentation. So clearly he'd struck a chord and had made a political statement that received some attention from the people he was talking about. I don't want to, I find the book very intriguing because and I don't want to put words in your mouth, but to me, what Dr. Metzl has talked about is the healthcare effects of arguments for want of a better word, white superiority, white supremacy, and the healthcare effects that these arguments have. He points out in a number of different contexts, in a number of different states, in Missouri, in Tennessee, in Kansas, how arguments that tend to argue that arguments of the sort we hear from President Trump that tend to divide people along racial lines, that talk about going back to a country where only one race of people was dominant, that those arguments are coupled with very bad healthcare effects when they're put into practice. Dr. Metzl, obviously you can talk about your book more effectively than I can. I just think it's a particularly intriguing book, and it's one of those books I think we're actually going to be looking at for many years to come, all of us, and if you're tuned in, you're interested in politics, all of us who are struggling, I'll just speak for myself, to really get a handle on what is going on with our country. Like, where are we? Why did Trump successfully get elected president? Why is he carrying out such bad policies that have such terrible impact on so many people, including the people that vote for him? Anyway, a lot of us have been struggling since 2016 to kind of understand our situation, our political situation. I believe this book is going to be one that we keep around as describing a piece of the puzzle. Certainly it was highly resonant for me as somebody who actually participated in some of the events described in the book, or at least was an onlooker in the Tennessee legislature. But without further interference from me, Dr. Metzl, why don't you just tell us about Dying of Whiteness and kind of your thoughts?
Well, thank you so much. I'm so honored to be part of this conversation and really speaking to people in my home state who went through a lot of the events that I write about in the book, and that were part of, as you were saying, Mike, about being part of the actual legislation. And so I'm really excited for this conversation. I also have colleagues and students who are joining me now from Vanderbilt, and so that's an honor for me as well. I'm actually in Brooklyn, New York right now, and the apartments are very small here, so that's why I've got a microwave and kitchen refrigerator behind me. But I guess really the book came about for a variety of reasons, but really one of the main ones was that I moved to Tennessee in 2010. I'd been at the University of Michigan before that, and then I got recruited to come to Vanderbilt. And that was around the time that all these debates about the Affordable Care Act were playing out. The Supreme Court had said, yes, the Affordable Care Act is the law of the land, but that every state can decide whether or not to expand Medicaid, whether or not to create its own competitive insurance marketplace. And this to me was a golden opportunity for a state like Tennessee for a couple of reasons. But I mean, I know the Affordable Care Act now is this political hot potato. But at the time in 2010, here's a state, Tennessee, that has a history of trying to insure its own people, through TennCare, and had actually been quite successful in the early mid 1990s at doing so. And then the program just got too expensive because people were too sick. There was too much unmet medical need. But Tennessee was a state that really wanted to insure its population. And Tennessee is also a state that makes a lot of health insurance. That's one of our export products in a particular way. And so it seemed like this was almost manna from heaven from a Tennessee perspective. And I go through in the book what the Affordable Care Act was promising to do and could have done if it would have been allowed to take full effect. But it was a bunch of things that Tennessee had already said that it cared about. It was free preventative care, community health programs, helping people pay for prescription medications, free or very reduced doctor checkups. And all of these programs were meant to really get Tennessee away from the burden of what was, chronic medical illness. If you don't have those kind of protections, then what you end up doing is you put off your doctor's visit. A lot of people are doing that now during the pandemic, and you can kind of understand it, that basically if you've got something like diabetes or hypertension or something like that, you should probably be going to the doctor every 6 months. But if every visit's going to bankrupt you, you don't do it. And so in a way, the Affordable Care Act was an answer to so many problems, I thought. Not that it was a perfect bill. This was like, I thought of it as kind of, Atari Pong or iPhone 1.0, like a technology that was your very first technology that was then going to be improved by user interface. And you would think, if you just landed from Mars, that this would be not really a controversial issue for Tennessee at all, because again, Tennessee had tried to insure its people. It had a hard time doing so because of money. And the other great thing about the Affordable Care Act was, because the pool of paying customers was the entire country, it was going to pay, the federal government was going to pay 7 to 9 cents on every dime. And so in a way, this was a great deal for Tennessee. But what happened in Tennessee was that there was, as we know, a lot of resistance. And so I started doing focus groups around the state with some colleagues of mine to say, why is it that people are pushing back? Why are people pushing back against this program, which shouldn't be all that complicated, right? It was going to expand Medicaid, which is a government program, and it was also going to create competitive insurance marketplaces, which is a private program. So it was kind of the best of both worlds, which in a way was what the model of TennCare was trying to do. And what we found was we did about 50 focus groups across the state between 2010 and 2014, 2015, as led up to the election. And I found, I think, a couple of things that I think are important for right now. One thing that I don't write about all that much in the book, but it's kind of struck me in retrospect, is that in 2010, when we started doing focus groups, everybody was pretty excited about the Affordable Care Act. Before people were told not to get excited about it, we did focus groups in conservative areas. We did focus groups in very, very red areas, very, very blue areas. But a lot of people were like, yeah, dude, this is going to give me health. This is going to give me healthcare. I've never had it before. This is going to help me pay for my meds. I can use any help I can get. And it was particularly going to help people who made just enough money to pay their own way, but they didn't make enough money. It was called the donut hole, right? This idea that basically people who were making just enough to not be on Medicaid, they were going to get support. And so the first point about what we found in the research was that initially people across the board were pretty excited about it. And then the same thing started to happen as what we're seeing in the country right now with masks. Like 5 months ago, who gave a hoot about a mask? And all of a sudden people are told, no, it's weakness, it's blah, blah, blah. It's other people are going to screw you over. And all of a sudden it becomes this political hot potato. And so we started doing focus groups across the state. And I think the second part that's important is that in our focus groups, particularly with working class people and lower income people, we found real racial divisions, real racial divides about how people felt about it. When we asked groups of African-American men, how do you feel about, we didn't ask them Obamacare, we didn't use any of the charged language. You said, hey, there's this thing called healthcare reform coming, how do you feel about it? And the Black men that we spoke with said, this is great. This is awesome. This is going to help everybody. And we're for it, not just for us, not for our own group, but also for the entire country. That in a way, we need health insurance. We need something, and it's going to rise up all people. And that was kind of the predominant narrative that we heard, even among African-American men who were quite quite poor and quite sick. And so you would think they would say, this is just something for my group, but no, they said, this is going to help the entire country. When we interviewed working class white men across the state, and we found some very different answers. Some people said, this is great, it's going to help me pay for my medications. But a number of people we spoke to said, there's no way I'm signing up for this because this is something that's being manipulated by the government, it's surveillance. And I think the dominant narrative that we heard is this system is being gamed by undeserving immigrants and minorities who are going to take money away from me and give it to these Black and brown people. And one of the quotes in the book in the beginning is, I was interviewing a guy who literally was dying of liver failure. He needed medical attention, but his quote was, there's no way I'm signing up for this Obamacare because I don't want my tax dollars, as he put it, going toward Mexicans and welfare queens. So this idea that I'm not going to support a system that that might be helping undeserving other people. And other men said, like, it's Black people are having 15 kids and they're using up all the system and all these kind of things, like all these kind of racial stereotypes that we heard, and that led to them rejecting Medicaid expansion, rejecting the Affordable Care Act. And that was important, and that became the jumping off point of the book, which is how powerful is an ideology that somebody who's literally on death's doorstep, somebody who has had a very serious medical condition or is dying and needs medical attention, how serious is this idea for them that this is what it means to be white, this is what it means to be a Republican, this is what it means to be a citizen of our great state, that in order to perform that, I've got to reject a healthcare system that could save my life, and in many cases would have saved people's lives. Some of our research subjects died over the 3 years of interviews. And so that was kind of the story of the book, was what were the steps that led to somebody who could have benefited really rejecting a life-saving treatment because they believed, had been told, had come to understand that that was what they needed to do as a good Republican, and that was what they needed to do to stop undeserving immigrants and minorities from gaming the system. And there's a lot of data in the book. Hopefully I put it in user-friendly terms, but I just show how bad that ideology is really for the whole system. I show that the effects of that kind of thing, because what happened was, it wasn't just these men who were saying, we don't want to expand Medicaid. It turned out that's how the state voted. And I just track the effects of that narrative. And I'll just say 3 points about that data and a few closing points, and then we can have a conversation. But I think one point about that data is really how unfortunate it is, right? Because if you think about building a healthcare system, you actually want the most number of people in the system, right? And so this thing about like undeserving immigrants, that was a total myth. It was a total lie. It was a way to destroy the system, because just think about it, if you're building a good healthcare system, you want as many different kinds of people in that system as you possibly can, because if you have 100 people in your system, or you have 100,000 people in your system, you want 100,000 people in your system, because if everybody's putting in $10 and one guy breaks his finger and the other guy needs a kidney transplant, you're going to have enough money. And so the attitude is, you want every kind of person, especially if the federal government's paying for it, you want every kind of person in the system, because that's going to make the best system. It's going to create the most effective system. It's going to lower your premiums. It's going to create competition among insurers, all these kind of things. So number one, this idea of we don't want those other Black and brown people in the system, it actually made the system work a lot worse for everybody. And if it would have been a system where people would have said, everybody, let's all join together because we're pooling our $10, the system actually would have lowered costs and increased health for everybody. So that's number one, is just that attitude really was bad for the system. Number two was that effect then really had system-wide effects, right? That what happened was, we didn't expand Medicaid. Kentucky, right next door, right above us, did expand Medicaid, did create in marketplaces. So the next part of the data research was, I just started tracking what happened to health outcomes, comparing Tennessee and Kentucky. And what I found was pretty remarkable. On one hand, it was definitely true. Minority communities in Tennessee did much, much, much worse than they did in neighboring Kentucky. I had an article this morning in USA Today about this, I'm sorry, US News, that basically in Tennessee, people didn't get health insurance and people just died sooner and had more medical bankruptcy compared to Kentucky. But the only problem was, because we're a majority white state, it turned out the people who got hurt the worst by that were the white Tennesseans. And so I just tracked this story. And really what I found was that not expanding Medicaid, closing hospitals as a result of not expanding Medicaid, doing all these other downstream effects of rejecting the Affordable Care Act ended up having dramatic effects for our entire healthcare system, to the point where everybody in the state suffered. In fact, if you were a white person, on average, you lost about 6 weeks of your lifespan. Not everybody did. Some people got more, some people got less. But that was because our entire healthcare system stopped working, because we didn't expand Medicaid. So it turned out everybody suffered, and that's really the key point of the book is it worth it? Was it worth it to reject these politics in a way that really, really, really hurt our state? And then the last part is I just go through and I look at other examples of this kind of story. So I look in Kansas, where they cut the education system out of the idea that, immigrants were coming and getting free education, all this stuff. It turned out everybody suffered. Dropout rates fell across the state, and they fell the most for white people in Kansas, because Kansas, like Tennessee, is a majority white state. And then a different story, but I looked at guns in Missouri, and looked at really what happened when people were being told that to be a good patriot was to have a gun, no questions asked, under your bed, on your nightstand, that kind of stuff. And again, there were dramatic health effects of that, which ended up shortening white people's lifespans. And so the take-home point was not in any way to ever say people shouldn't have political opinions. I think healthy debate is very important. But to say that the ways in which a lot of these policies, it was really the metaphor for this book for me, was this guy who was rejecting his own healthcare because he was so convinced that other people were going to game the system, and the way in which everybody lost from that system. And really what I show in the book is that, we're all in this together. I think this virus is showing us that either we kind of rise up together, we create systems like the Affordable Care Act that join us, that we join together, that we can build together. Or, look what's happening in this pandemic. We can't agree on core public health issues, and it's really shortening our whole lifespan as a country.
Well, and I of course found, first of all, thank you. And I, of course, found your chapters on Tennessee particularly interesting because I was there in the key committees when Governor Haslam was trying to pass Insure Tennessee, and when he was met with this barrage of arguments, and you dismissed the arguments in your book as untrue, particularly arguments that there would be this massive cost to the state, which was just, mathematically wrong, because the federal government picked up first the entire tab and then virtually the entire tab for the expanded health care. And it was shocking to see it occur, and then to read your book where you're talking about these focus groups and what people are saying, because those very words were coming out of the mouths of all these Republican legislators who'd been handed them by, maybe some of them felt them deeply, but certainly the words that were being spoken on the House floor and in committee were identical to the words that were on pieces of paper handed out by Koch brothers funded Americans for Prosperity and other super conservative groups. I'm curious, am I remembering right that you talk in your book about the health effects in Tennessee and how, as you point out, literally not expanding healthcare took weeks off the lives of many Tennesseans, in the aggregate, and much more for many people, led to the death of many people. And right, you point out that that's consistent with the national studies. You talk about Professor Summers at Harvard, who has studied this in multiple states, and in every state to state comparison, right, it's just recognized now that those states that adopted expanded healthcare under the Affordable Care Act have seen reduced mortality compared to similar states that did not adopt it. Is that now at this point pretty much accepted?
It's a slam dunk right now. And especially right now. So I think there are really a couple of things that are important about that analysis as to why that's true. Number one is just think about it, if most people don't have health insurance, what are they going to do? They're going to wait until they're really sick, and then they're going to go to the emergency room. That's what happens when you have a lot of uninsured people in your state. And that's what happened in Tennessee without expansion. People didn't go in for regular checkups. They didn't, we can see it happening right now. It's not a mystery. I get a text every month, every 2 weeks from my dentist saying, come in for a teeth cleaning. I'm like, dude, there's a pandemic right now, but I'm saying the more you put off things, when I do go in for that teeth cleaning, hopefully, it'll be okay. But the more you put off routine visits, the more expensive things happen. And if the thing you're putting off is treatment for diabetes or cardiovascular disease or anything else, expensive ER visits drain resources from the entire system. And that's what happens when you don't expand Medicaid, is people put off visits, they don't go into regular checkups, and there's just less resource in the system because healthcare systems close, right? Rural hospitals close. And so what happened was all the resources drained toward emergency rooms, and that drained everything from the system. Some people could pay their way out of it, but for the most part, if you're like a working class person, this whole system you're in Tennessee is not going to work as well because all the resources are being drained toward this one very costly expense. And so number one, just people weren't going to the doctor, so that's bad for your health. And the system wasn't working well. That's not very good for your health. And the other thing I found comparing Tennessee to Kentucky was the cost was much greater. In other words, if you had the Medicaid expansion, again, I'm not saying ACA was perfect, but if you could get some help going for routine visits, paying for your medications, you were much less likely to have a medical bankruptcy. And the other point is your insurance wasn't automatically tied to your employment. And so there were far fewer people in Kentucky paid less for medications. They had fewer medical bankruptcies. So this whole cost idea is really honestly preposterous, because just look at how many medical bankruptcies there were in Tennessee and compare it to Kentucky. That's what I did. We paid more for the same drugs. We had more medical bankruptcies. We paid more for routine office visits, just flat out. And think about it now during the pandemic. I mean, it's horrible. People are losing their employment, and because employment is linked to health insurance and there's no safety net like the Affordable Care Act, it ends up costing us even more. So on every level possible, I mean, when I started, honestly, I had a full head of hair when I started thinking about the cost argument. It was so frustrating for me. Look what happened to me. Don't do this. No, but I'm saying it's just preposterous. It ends up costing our state so much more.
Morning, I have to say.
I'll tell you, there's not enough Rogaine in the world. And so let me just tell you that it's just the whole cost idea is absurd, because it ends up costing our state. And so what do we gain from that? I think really that's the question. What do we gain by having people sicker, by paying more? And that's really the question. Is it worth an identity? I mean, people might say that my identity, my alliance with President Trump or something like that, that's worth my health, because that's really that's really what he's asking people to say right now. And even when we knew this, even when we had all this data and the pandemic hit, the responsible thing to do would have been to say, okay, look, we have all this data. We're going to expand Medicaid across the entire country, because it's the laws on the books. We're going to push the 14 states, maybe now 13, because Oklahoma just did it. But we're just going to say, like, enough is enough. People need health insurance during a pandemic. So even with all this, to not during the pandemic, it's going to cost our state so much more, because again, people don't have a safety net. And so just the cost is to me, it's completely unconscionable and unimaginable.
Well, and you're we've got questions that I'm gonna hog you for just a moment more. I wanted to thank you, by the way. I thought it was very compelling, and maybe it's because I'm biased because I'm a Democrat, but you pointed out the efforts in Tennessee early on in the 90s to expand healthcare with 10 Care program, and that was Governor McWhorter and Speaker Jimmy Nafee, Lois DeBerry. These are the leaders that brought that program Tennessee. It was a very innovative program. And the idea was, as you point out, was to provide all of this coverage. So it's clear that this was a Tennessee value. I mean, it's not like people in Tennessee don't want to be healthy. They like their families. Um, you know, with your sociology background, can you talk a little bit about, I mean, what do we do? How do we address these attitudes that seem to make people prone to believe these bogus arguments? Because that's what I saw. I mean, I was there sitting in these committees where these road arguments are made that are totally wrong about how Obamacare is going to be this huge, big problem. And what was disappointing is it was resonant enough that elected officials accepted those arguments, blocked a popular Republican governor's proposal. I mean, Governor Haslam at the time had a 70% approval rating. You know, he was not a politically wounded governor. He was a strong governor, but it's one thing for me as a Democrat in a minority to not be able to push a policy, but even this governor could not get his own people to accept this because were just in this hammerlock of nonsense. What do you see for the country going forward? Do you have any hopeful ideas about how our society can shift to get back to where we can have a rational discussion about these relatively complicated healthcare issues?
What a wonderful question. I mean, there's so many great parts of that, and I'll just jump into a couple of them. I mean, first is about the TennCare example in the 90s. And TennCare, it wasn't uncontroversial. In fact, it was quite controversial. But really what it was responsible leadership, people willing to be brave, stick their neck out, people willing to work across the aisle, and this terrific Tennessee tradition of government working with private industry. And in a way, what happened with TennCare initially was an incredible success story. If you look back I cite some of the newspaper articles from TennCare from the 90s. We had a 94% insurance coverage in our state in 1994. I mean, it was not unsuccessful in the beginning. We really, really wanted to do this, and everybody liked it in the beginning. The problem was, again, as I said, that there was just too much really chronic health need because people hadn't been to the doctor. It's like, hey, doc, you know, I haven't been to see you in 30 years. And so it wasn't like I need a physical for my high school soccer team. It was like, hey, here's 30 years of diabetes, here's what it costs. And so I think that people rallied around the need for healthcare, and it took responsible centrist leadership from both parties. So that, I think for me, the lesson of TennCare is that. And number two is, it's so easy to destroy these programs if you tell people that if you get people to mistrust each other. In a way, big social programs are effective if people trust each other. And they identify goals that people want. I want healthcare for my family. I don't really want to worry about going broke if I go to the doctor. But the minute you start telling people, hey, that Black person's going to rip you off, or that Latino person's going to have so many kids and they're going to be draining the system, it turns out that's actually not how social programs work. You know, like as I said before, you want the most people in the system. But the minute you start like creating, I mean, we have a very complex racial history in our state, and there's been work before all this horrible period to try to at least begin to address it. But the minute you start playing people off against each other by racial resentment and racial anxiety, which is really what all this was doing, you know, with Obama, with the African witch doctor posters and all these, was just straight up racism. That in a way everybody fails, but when you do it based on, you know, racial stuff, it's just very hard. It's almost like people lose their minds, and in a way, I don't know. And so that's number one. It's just that these racial divides, and really in a way, that's what we're still fighting about in our country right now. That we're still arguing about, and for an important reason, because a lot of these issues are serious, and they've gotten worse. And Trump has exacerbated them. So what to do about it? The other part of your question. You know, believe it or not, on November 5th and November 10th and November 15th, we're still going to have a country, I hope. And if that's the case, we're going to have to work together. And so everything feels like it's about this election, which it is in a certain kind of way. But then we're still going to have to work together. And so right now, the stakes are very high. I understand that. And also, we're just terrified right now. You know, you walk outside your door, there's some thing floating in the air that could take you down. And it's a scary moment. And it leads us into, you know, tribalism, isolation, and it's scary. I understand that it's scary, but ultimately the only way we're going to get out of this is if we work together. And so I hope that whoever wins the election can bring us back together with a kind of common goal, because we've done it before, and I think that, you know, again, it just takes addressing honest truth and reconciliation about how we got to this point. But I also think that, you know, I just think the lessons of what I'm talking about in my book are really quite existential. That either we figure out a way to work together across our divides, which we've done before, that's what made us who we are in the first place, or, you know, we fail. I mean, we're facing a common enemy right now, this virus, and we're facing a common enemy of racism, and either we work together to fix these problems, or we're in deep trouble.
I think that's a very good point. I have to say, as somebody who's elected, which is to say there's a huge value just in the ability of leaders to work with each other and be honest, and maybe holding those as just high goals unto themselves will help us move out of this period. Because as you say, it's not like all these problems are just going to evaporate based on the outcome of this election. We can, this is my political bias, I think we can solve a lot of them with this upcoming election, but they'll persist. We certainly will not have a model healthcare system in the United States next year. And we need to move toward that, obviously. Okay, we've got questions. Here is a question. Why are so many folks unaware of the 10 essential benefits that have always seemed to be one of the most significant parts of the Affordable Care Act? Do folks really appreciate how this puts everyone, not just the Affordable Care Act enrollees, on a level playing field?
I am the biggest proponent of the Affordable Care Act, to be honest, because not because of what it did. Obviously, it was, there were a lot of kinks, as with any legislation. But I thought that the Affordable Care Act was like a serious, sustained effort to at least get all the parties around the table and to begin the process. It wasn't the final product. I know premiums were high. I know it wasn't public enough for people. I think ultimately you would have had a public option. I know it wasn't private enough for other people, but I think that if you just look at Affordable Care Act 1.0, which again is like iPhone 1.0, it never was intended to be the final thing. But even Affordable Care Act 1.0 had all of these great things that would have been great if we had them in the country for the pandemic. One was investing in communities, public health infrastructure, protecting pre-existing conditions, not getting, supporting people so they don't get kicked off the insurance rolls. Like all these things that would have been so great at knowing that we were going to face a horrible situation like this pandemic. They were strengthening communities, community interventions, rewards for communities that were healthier. All these things. I mean, Tennessee has a very high public health, even before the pandemic. We've got a lot of obesity, a lot of cardiovascular disease, a lot of smoking. So it was kind of going to help the state address these public health issues also. So the parts of the Affordable Care Act that we could have at least started to work out, which again, to my mind, would have led to a public option, and also would have been good for the insurance marketplace as well, because it would have created competition for people who wanted to keep their private insurance. So for me, I just urge everybody on this call to just go back and, put on some nice music, pour yourself a nice glass of something. Okay, a nice glass of wine or something like that. Or I was going to say Corsair Distillery. It makes me homesick. And read the Affordable Care Act, because that's what the Supreme Court and Trump administration are trying to kill in the fall. There's a case from California and Texas, which are, as people know, if they read my piece this morning, the Trump administration tried to kill the entire act. And that's what they're killing, are these 10 points that really created at least a foundation for a national healthcare system. And the other point, of course, is show me something better, right? There's no backup plan. So there's no backup plan. And so, um, Trump, when he ran for office, he kept saying, I'm going to kill the Affordable Care Act. I'm going to replace it with something better. Where's the beef, right? And so, so I think the stakes on this are quite high. And I think people really should really, really pay attention, because I think that really, that would just have huge impact for our entire country.
Well, it's funny. I like the iPhone analogy because, of course, the iPhone 2.0 had the slogan, twice as fast, half the price. But the problem is the Supreme Court had kept interfering with the original iPhone and taken away a lot of its original components. I suspect that Steve Jobs and his team could never have made that leap. And that's the problem with the Affordable Care Act is everybody's been picking away at it, so we haven't had a chance to take the initial apparatus and improve it. And as you say, it's under this court challenge. And what a extraordinarily aggressive and improper use of the courts it would be to overturn an act that represented an entire year of legislative activity. I mean, that would be going back to post-depression court interference with our democratic system, probably with the same ultimate response. But here's another question. Will fear of change make it hard to convince people to reboot our healthcare system coming out of this horribly destructive and destabilizing pandemic? How do we counter such fear if it's important? That's a fascinating question.
No, it is, because like we are all afraid. I mean, we're differently afraid. We're definitely vulnerable, but our species, as a species, doesn't really have immunity to this common threat, and so we're afraid. Change seems terrifying right now. I mean, going out of your apartment, getting groceries, everything seems terrifying right now. So I can certainly understand the resistance to change, but I also want to highlight that in moments of the greatest challenge, those are the moments when people are also sometimes the most innovative about imagining better futures. In the piece from this morning from USA Today, from US News, I did USA Today the day before, but I was talking about an economist, Amartya Sen, who writes about what happens sometimes when societies have faced their biggest challenge. And he writes about Britain during the Second World War and how they were being bombed. London was being blockaded. And at the time, instead of saying, we're going to consolidate power, what they said is everybody has access to healthcare and we're going to ration food so everybody gets food. And it turned out life expectancy in the United Kingdom went up by 7 years in the aftermath of World War II, even at this horrible period. And they also created the foundation for a national healthcare system that lasts until this day. And so sometimes crisis moments with the most creative and innovative leadership and the most buy-in, that's the time when you actually can make a change. And I just bring everyone back to early March, for example. We were all terrified. Nobody knew what to do. And if at that time we had the leadership that would have said, okay, look, man, I don't care if you're Republican or Democrat, we're all in this together, and really created a national vision of how we can build institutions that would have created infrastructure to help us against the virus. It would have addressed the inequities in our society that made certain populations much more vulnerable. That would have been the moment to reinvent our country. We so far have lost that moment, and I just hope and pray that we get back there, because we have a lot of great will and a lot of creativity in this country. And it's really not too late, but we really have to start imagining our structures and honestly working together, which is really what Trump's trying to get us to do, is to mistrust each other and not work together. That works for him. It doesn't work for us.
Yeah, I mean, a lot of us, elected officials have talked about this. To the right president, the coronavirus would be, while a tragedy, an opportunity to seize. To show leadership. It's a little bit like George Bush with Katrina, rescuing people after a terrible emergency could have really improved his approval ratings. I mean, it could have made him a great national hero.
Yeah, this was his moment. I mean, in a way, this was his moment. And he would have had everybody behind him. I mean, when this thing first hit, I've not agreed with anything, very little President Trump has done, except for ordering fast food meals for sports teams. And I still was rooting for him because I wanted to save as many lives as we could. So this was a moment where he could have said, this is our time. This is our time. And instead, he's trying to pit people against each other, which is the worst possible response.
Right. That's what's extraordinary. Because I think everybody at the end of the day, he presents himself as a strong leader in his rhetoric. So if there was ever a time, it was, there was a place for somebody to create a national plan and impose standards and help the country coordinate to respond to this threat. It was the response to COVID-19. And it's interesting that his instincts have been to continue to divide, not to take charge. It's like he's presented with the battle. He's sitting there on his horse. He's not willing to ride down the hill and get to work. It's the strangest thing.
And it would have taken brave leadership, right? Because this is scary. Yeah, this is scary time, right? And so you're going to tell people something that they might not want to hear, but it's like, we're going to save the most lives if we wear a mask. That might not be what everybody wants to hear. Who wants to wear a mask? Nobody. But this is what we're going to do to protect our communities and our country. And so in a way, the brave move would have been to stand up for the principles of our country, and instead playing to saying stuff people already want to hear. Certain people, to me, that's like the easiest and least leaderly response.
Well, and it's funny, anticipating your last statement, the next question is, do you think government should enforce the wearing of masks? What role should county health departments play in serving the people? So it's two different questions.
Right. It's funny because if that's the question, yes, we should be wearing masks. We should be wearing masks because that's what we're going to have to do. But I think that really enforcing masks, if we're arguing about enforcing masks, we've already kind of lost the battle, because it's not just about enforcing masks. It's actually like, what's the rationale for wearing a mask in the first place? We wear a mask to look out for each other. And so if we're trying to force people to wear masks as if it represents some intrusion, and that's the debate. I know that's the debate we're having now. But in a way, we've lost our national sense of unity about why masks are important in the first place. So I think we need a national referendum on what binds us, in a way, what we can do. And I'm sorry, I'm in New York, so you're hearing a lot of sirens in the back. And even here, it's scary, but I think that in a way we get through this by working together. And so I think part of the referendum has to be about, here's why we wear masks. Not that anybody wants to do it. There's probably some nut job out there who loves wearing a mask. I don't like wearing a mask. You don't like wearing a mask. But I'm saying the rationale for wearing a mask is why we do it is we take care of our community. We take care of our at-risk people. This is who we are as Americans. This is what our country stands for. So for me, there's got to be a reckoning of this issue and why this issue has become so polarized. And after that, I do think we need to wear masks, because that's just what we got right now. It's like the only thing we got. And I think, that's really got to be the conversation. I wish there was a better answer about having a treatment, but and I agree with David's comments here. Really, 6 months ago, who cared about a mask? Nobody really cared that much. So it got taken up by the same thing that I found with the Affordable Care Act, which is this polarizing message. And the minute people get that, so I don't know. I hope we all wear masks, and I hope we get to the point where we understand why that's important. And I'll just say one last point, because I'm on my soapbox here about this, which is to say, I was doing an interview for a Tennessee paper last week, and it was a nice interview, but the guy said, well, I know, we should wear masks, but it's unreasonable to get people to change their behavior. And I started thinking about how untrue that is, actually. If you go to a nice restaurant, nobody's smoking a pack of cigarettes in the restaurant. And the reason they're not is because we know that secondhand smoke is bad for everybody's health. They can go home and smoke a pack of cigarettes. They can, I live in Printers Alley. They can still go to a lot of bars there and smoke cigarettes. But in general, we stopped smoking in restaurants. We stopped smoking on public transportation because we look out for people. Wearing seatbelt in your car, that was very counterintuitive in the 50s. And then we do it to protect people as a society. I mean, what's weirder than wearing the prosthetic implementation that stops another person from catching a sexually transmitted disease from you or getting pregnant? Like, what's weirder than putting that thing on? But we do it to protect public health. And so we've done all of these different kinds of public health interventions. And they're weird in the beginning, and then they become normal. And then if you don't do it, you're the weirdo. And so in a way, we make changes for health all the time, and I think that the thought that we can't do this, to me, is completely preposterous.
Well, and you talk in your book about the false promise of supremacy and link it to, or at least I read it as such, the disregard for population-based health benefits in our debate. And that's a general trend. Any thoughts on that? I mean, why is this something we're suffering right now? Why have we turned away from this focus on population-based health? Is it just because we got so used to living in a society where, most infectious diseases had been cured and we essentially got used to relatively good public health? Is that what happened?
And I think that's part of it, but I think the other part is people just were fed so much this narrative of it's us against them. We became, beneath all the veneer, we became a very tribal society. And I think all of this messaging, I mean, really the Affordable Care Act was a preamble. People were told, oh, that other person's going to come take your health, take your privilege, take your money, take something. And so in a way, this constant messaging, effective public health, it depends on imagining a greater good. And when you can't do that because everybody's afraid that everybody else is going to screw them over, and it's based in racial fault lines that have been present since the beginning of our country, constantly being fed that, people lose the idea of why we have a country in the first place. And so in a way, I think really it's the messaging. Public health depends on imagining a public. And when it's a bunch of different publics, it's just not as effective.
We've talked mostly, and I started asking you questions about Tennessee because, of course, we're here and it's so interesting. But you have this whole section of your book, the first section of your book on Missouri and on loosening of gun laws and the resultant rise in suicides, and particularly among white men. And I wonder if you could talk about that a little bit. Honestly, that portion of your book raised in my own mind, and I've been fighting all of these expanded gun laws, the stand your ground laws, and all the laws that were adopted in Missouri have now either been adopted or there's been an effort to adopt them in Tennessee. I had not, until I read your book, really understood the linkage between that and this rise of suicides, because when we talk about gun laws, suicide tends to be kind of one of the lesser things we talk about as opposed to crime and so on. Could you talk about what you found and just generally speaking, whether it's a national trend that we are all going to experience, unfortunately?
Well, I'll tell you, if you don't mind, three things, because I have so much to say about guns.
Yeah.
Number one is, I'm not inherently anti-gun. I know we have a Second Amendment. I don't want to take anybody's gun, and I probably wouldn't really exactly know exactly what to do with it. But I respect that we have a tradition in this country. I grew up in Kansas City, Missouri, and what I'm against is what happened to Kansas City, Missouri, with the advent of the kind of laws, Mike, that you're talking about, which are these laws that were not about people had guns. They grew up hunting and family traditions and stuff like that, but they started to be fed this line that you need a gun to protect yourself because somebody might carjack you, or you don't trust your neighbor, or all this kind of stuff. And they opened up the guns. I mean, really, it was, eliminated the permit process, eliminated any kind of, lowered the age to 18, open carry, concealed carry, everything like that. And what happened was it destroyed the city in certain way. It didn't just destroy the city because of shootings and death. It destroyed the city because people stopped trusting each other. All the communal sites where people used to congregate, parks, concerts, and not just that, across racial and class lines, all of a sudden became incredibly fraught because nobody knew who had a gun and all this kind of stuff. So I personally felt like guns, among other things, really destroyed a sense of the public that I was just talking about in Kansas City. This idea that anybody can get a gun led to just certain people enacting things in certain ways. And really there was a huge breakdown in civic society because, and again, before all this, you could get a gun pretty easily, but it wasn't like everybody needed to load up on any AR-15 and take it into every Walmart. And it created a lot of racial tension, a lot of mistrust, a lot of shooting. The second part was there were spikes, massive spikes, when it became easy to get guns. But even though the media was talking about it as like black on black crime and gang shooting and all this stuff, it turned out that the biggest spike was white male suicide, off the charts. Having a gun in your house is the biggest risk factor, believe it or not, for having a gun suicide in your house. And a lot of people were getting guns who hadn't been trained, didn't know safe storage, all this kind of stuff. And so white suicide went through the roof. And I worry about that now because of what's happened to gun sales during the pandemic. A lot of people have guns in their house with kids in their house without a lot of training. And so when you're focusing on black crime, which is a much smaller percentage, and I'll give you a number, before the pandemic, we had 40,000 gun deaths a year in this country. Believe it or not, like 26,000 of those are gun suicides, and 90% of those are white men. So most gun death before the pandemic, we'll see what happens now, was white male death, right? And so this is another example of dying of whiteness, this gun representing your patriotism, also being a symbol of demise. And so again, I'm not against guns, but I think that when it's so unrealistic about why people need guns, and just this kind of fear, of other people machine that we've created, what it just leads is what happened in Missouri, which is people mistrusting each other, segregation, all the horrible things we're seeing now. And so I don't know, guns for me are an issue because again, it's just the more you go down that path as a society without some kind of reasonable middle ground, the more it creates suffering, and it leads to really just the breakdown of, I think, the kind of world that a lot of us want to live in.
Well, and you found that literally, you talked about the white male suicide rate going through the roof. I mean, you're talking about thousands of additional suicides nationally, and you identified over 400 additional suicides in Missouri that you thought were pretty easily correlated to the change in gun laws in 2007 and 8, when they very much liberalized the ability to have guns and to carry guns. Is that fair?
And the stories were just so sad. I interviewed lots of just incredible people, but, wives who had lost their husbands, parents who they had their guns out on their nightstands, and they lost children from accidental shooting. I mean, nobody should suffer that. And so, again, I realize that guns, they represent autonomy, individualism for a lot of people, but I also think that it's kind of like, you live in a society, we've got to imagine some kind of middle ground. And I think just continually pushing, you need 30 AR-15s and guns on your nightstand, and it's not the government's job. It's just that path is not a good one. It's not a good one for a society.
Well, and I say I've been neglecting a question. This will be our last question, given the time. What are the steps we need to take in Tennessee to expand Medicaid, and how do we message it effectively so that all Tennesseans, regardless of political party, can understand the benefits? Is there an entity that would be willing to fund a massive public awareness campaign, a foundation, insurance company, etc.? We're expecting you after this event to find the entity. I'm joking, but I am curious about your thoughts. It's a great question. We've all been asking it. How how do you message the need for expansion, or what's your insight from all of the focus groups you've done? I mean, you've probably talked to more people about this than any other single person. What are your thoughts? How do we get through the mist and get the right message?
I think that there are great answers to that, actually, and anybody who wants to know, just please contact me afterwards, or Mike, maybe you and I can talk a bit after this, because I think it's so important. Before the pandemic, I was writing a piece which became part of the new afterword for the paperback of the book, which was written before the pandemic. But I said there are examples. One is right near us. It's a place called Kentucky, where there was a very solid, centrist, bipartisan-ish message about the effects of what it meant to have versus not have healthcare, what it meant to have versus not have Medicaid expansion. And it was effective. And it was effective initially. And then it was effective in the gubernatorial election before the pandemic, where people basically voted to support the Medicaid expansion. I think there's a lot of important lessons from that Kentucky election, the gubernatorial election in 2018. That was basically about how we talk to people about health through core common values without using polarizing language. And I think that a lot of people, it just let a lot of people feel like they had an investment in it. So it wasn't either you're for or against, like we have these litmus tests. Are you for or against Medicare for all? Are you for or against the Second Amendment? I don't know. The world is not just for or against something. And so, in a way, I thought the Kentucky election was quite an interesting one. There's also a gubernatorial election in Louisiana in 2018 that created a kind of bipartisan message of here's what healthcare can do for you. And I think right now, I think it's fair to ask the Trump administration, have you done that for people? So I also think there's a counter argument, which is, where's my healthcare? I'm paying taxes. I'm supporting you. Where's my healthcare? And so I think right now, both of those things are true, but I urge people to study those two gubernatorial elections, because I thought that they were both great examples of effective messaging. And at least early in the pandemic, because they had bipartisan coalitions in Louisiana and Kentucky, they actually were better able to handle the pandemic in ways that I think are, we'll see. It's been a long, bumpy road for us, but I think that in a way, there are lessons at least from those elections and what happened afterwards.
Well, we are out of time, and we try to close these on time. Thank you so much. What an insightful book. Thank you for taking time. Obviously, you're writing in all these national publications, and your time is very valuable. So we in Tennessee really appreciate you taking the time to talk to us. Again, my own view is, we're all looking around for ways to move our country out of the current political situation and get back to a situation where we can do great things and constructively address the challenges that our nation faces. The nation, we're still the nation, that invented the airplane and then invented the personal computer. I mean, it's the most extraordinary, dynamic governmental entity that ever existed on the face of the earth. But right now we're stuck and we're not solving our problems and we're not acting effectively. I think your book provides a lot of insight into the challenges we face, and thus it kind of starts to get us on the road back. So thank you for your service in writing it. Thank you for talking to us today. I'm sure everybody, and you've had a whole bunch of people in and out of this event, really appreciates you taking the time. And we look forward to reading your next book as well. No pressure, but I'm sure it'll be just as good. Hopefully, you won't have a big band of armed people show up at your first event for your next book. But
listen, yeah, I mean, thank you, and it's great in the comments to see Campbell and David and a lot of my community friends there. So that's great. And again, I agree with you that really what's happened now is that we've got a federal government that's trying to set people against each other. It works setting people, but that's not who we are. We've worked together to solve really complicated problems in the past, and I think that's what we've got to get back to.
And again, thank you. Let me do a quick plug. Anybody who's got any questions, of course, you can always email me at mike@mikestewartfortn.com or just call me on my cell phone, 615-406-8719. Our next Zoom, Nathan Bedford Forest 8 Can't Wait and Race Relations in the Tennessee Legislature with Representative Vincent Dixie will be Monday, July 13th at 5, from 5 to 6. So look forward to seeing some of you then. Again, Dr. Metzl, thank you so much for taking this time. We really appreciate it.
Take care, everybody. Stay safe.